Hello guys, so welcome back. So today we shall be discussing another topic from the Clostridial species, right, that is Clostridial difficile. So previously we have spoke about Clostridium botulinum, Clostridium perfringens, Clostridium tetani, etc. right. So today we shall be discussing the last topic in the Clostridium species, that is Clostridium difficile. So if you compare all the Clostridial species, the remaining Clostridial species which I have discussed other than this Clostridium difficile, the remaining three are very important. Okay, so Clostridium difficile is obviously it is also an important topic, but there is nothing much to discuss in this topic. Okay, so we shall narrow down all the things and then we shall discuss it and finish it up fastly. Right. So when it comes to Clostridium difficile, as always, let me write down the classification. Right. So in basic classification, what you know is that gram positive bacteria. Right. So all of you know gram positive bacteria. So if I divide the gram positive bacteria into two types, there are some gram positive bacteria which are circular in shape and there are some gram positive bacteria which are in the form of a rod. So there are some gram positive bacteria which are circular in shape and these circular bacteria are called as cocci, and there are some gram positive bacteria which are rods, which are called as rods. So what is the concept about this? Let us discuss about the rods and let us discuss about the cocci. When it comes to cocci, right, so there are two types of cocci in turn. There are two types, right. Some of these cocci are found in the form of a chain, right. So they are called as streptococci. Some of them are found in clusters like grape shape, they are called as staphylococci. So one is streptococci and other one is staphylococci. Right, we shall not go into detail about the cocci. We shall go into detail about the rods. We are discussing about the rods right now, right? So coming to the rods, how do you classify rods? How do you classify rods is that there are some rods which are aerobic, which can live in presence of oxygen, and there are some rods which are anaerobic, which live in the absence of oxygen, right? So there are some rods which are aerobic and there are something which are anaerobic, right? So what is your concept of aerobic and anaerobic? I have explained you just now that aerobic organisms can live in the presence of oxygen. Anaerobic organisms can live only in the absence of oxygen. So what if I provide oxygen to these anaerobic organisms? They die. Why? Because I have explained this in very much detail why anaerobic organisms die when they are exposed to oxygen. So I have explained this in the previous video. So please check the previous videos and clarify your concept. Now, when it comes to the aerobic organisms, what are the examples which you can give? One is the bacillus. And next, all of you know it is the Nocardia species. All of you know Nocardia species, right? Next, Listeria monocytogenes. Hope all of you know. And finally, Corynebacterium. So all of these are the aerobic organisms. Now when it comes to the anaerobic organisms, what are the anaerobic organisms? We have got our Clostridium. You know the Clostridium species. And finally we have got Actinomyces. Right. So Clostridium species, obviously all of you know that all the Clostridium species, they release what? Very good, they release spores. All the Clostridial species, they release spores. So this is the basic classification. So having said this classification, now you understood that what is Clostridium difficile? Clostridium difficile is a gram positive rod shaped bacteria and anaerobic and forms spores, right? So shall we write down? Yes. So what is Clostridium difficile? What is Clostridium difficile? Clostridium difficile is gram positive rod which is anaerobic, and these Clostridium difficile, they release spores. So these three things you know very well. Now when it comes to spores, when you discuss about spores, what is that one important thing what you have to discuss? One important thing which you have to discuss, I have been repeating this again and again, that spores are heat stable and chemical stable. Not only heat stable and chemical stable, but also even, see, for example, if I get dehydrated and if I am not receiving fluids, then I die immediately. Right, so spores, I told you that spores are heat stable, at the same time they are chemical stable, right? So heat and alcohol resistant. Let me write down this thing. Spores are basically heat stable and they are chemically stable. Heat stable as well as chemically stable. So even in dehydrated state, the pores survive. Even in dehydrated state, the spores, they survive, right? So, but anyways, is Clostridium difficile really a pathogenic organism? No. Clostridium difficile normally lives in my intestine and your intestine. Clostridium difficile is what? It is a normal gastrointestinal flora. So, let me add my fourth point, that it is a part of normal gastrointestinal flora. It is a normal gastrointestinal flora, right? So, what is the problem with this? What happens? See, for example, okay, I have Clostridium difficile in me, you have Clostridium difficile bacteria in your intestines, but the problem comes not with the Clostridium difficile. The problem comes when you take antibiotics. When you take antibiotics like clindamycin, right? And there are different types of antibiotics, and also there are proton pump inhibitors. So I'll be discussing them anyways. But overall, just believe me that whenever you take antibiotics, what happens is that these antibiotics kill down the bacteria, kill down the normal gastrointestinal flora in your intestine. Does the antibiotics kill down all the bacteria? No. It will spare Clostridium difficile. It will not kill Clostridium difficile. Other than Clostridium difficile, it is going to kill the remaining organisms. See, for example, if you are a guy sitting in a room, right, if there are 10 people around you, you cannot behave as you want, because those 10 people around you will be controlling you. Yes or no? Controlling your behavior, right? Controlling your actions. But if I kill down all those 10 people, then is there anyone to control you? No. The same thing is that the normal intestinal flora, right, controls the growth of Clostridium difficile. It does not let Clostridium difficile to grow more, right? So, when I am taking an antibiotic, these antibiotics are killing down all my normal gastrointestinal flora. So, when all my normal gastrointestinal flora are dead, the bacteria which are not dead are Clostridium difficile, and Clostridium difficile starts to grow. So, as the concentration, as the number of bacteria increases, obviously the pathogenicity also increases, right? So, what I exactly try to tell you is that, for example, this is your esophagus, stomach, and let us say this is your entire intestine. This is your intestine over here, right? So, here you see there are Clostridium difficile bacteria like this. There are Clostridium difficile bacteria. Let us say this is Clostridium difficile. Along with Clostridium difficile, you also have different other types of bacteria as well. Along with the Clostridium difficile, you also have different other types of bacteria, right? So, let me draw a couple of them. See, you see, you have different other types of bacteria. Now, whenever I am taking antibiotics, what these antibiotics are doing? These antibiotics will travel all the way like this. They will travel all the way. And what are they going to do? They are going to kill down all the GI flora. So, when they are going to kill down all the GI flora, leaving Clostridium difficile, then the concentrations of Clostridium difficile, right? So, what is happening with the concentrations of Clostridium difficile? The concentrations of Clostridium difficile, they keep on increasing. And that what causes pathogenicity. So, how pathogenic is it? How virulent isn't. What are the virulence factors that are released by this Clostridium difficile? So when we talk about the virulence, that is caused by this Clostridium difficile, so what are the different types of virulences? Look here, this Clostridium difficile, right? So this so-called Clostridium difficile, basically it releases two types of toxins. And what are these two types of toxins? One is called as toxin A and the other one is called as toxin B. Okay, one is called as toxin A and the other one is called as toxin B. So what is the other name for toxin A? Toxin A damages your intestine, right? It damages your colon. So this is also called as enterotoxin. Enterotoxin. Then what is the other name for toxin B? Toxin B is also called as cytotoxin. Why? Because it damages the cells of the intestine, enterocytes of the intestine. So one is called as enterotoxin and another one is called as cytotoxin, which is toxin B. So what is going to happen exactly now? What is going to happen is that this toxin A or enterotoxin is the toxin which is going to cause watery diarrhea. And this toxin B or cytotoxin, what is it going to do is, look here guys, look here now. Let us say this is your intestine. This is your intestine. And in this intestine, you have got your cells like this, a numerous amount of cells. And these cells are called as your enterocytes. So these cells here, which I am drawing right now, these cells are called as your enterocytes. Now, in these enterocytes, what is the specialty is that one enterocyte and the other enterocyte are joined together with the help of proteins like this, right? So these are desmosomes or the tight junctions, right? If this cell, this is another enterocyte, see both of them are locking like this and attaching tightly. Why? Because there is desmosome in between. There are tight junctions that are connecting both these cells. So if I break down those tight junctions, what will happen? If I break down this one, what will happen? The cells will go loose like this. So cytotoxin or toxin B is going to break down what? It is going to break down all those tight junctions, right? It is going to break down all the tight junctions. So when it is going to break down all the tight junctions, all the cells become loose and the cytoskeleton of the cell, I mean the structure of the cell is disrupted. So can I tell that if I have toxin B or cytotoxin that disrupts my cytoskeleton? Disrupts cytoskeleton structure. Disrupts cytoskeleton structure. Okay, fine. So it has disrupted your cytoskeleton. So what is happening with that? What will happen when your cytoskeleton has got disrupted? What will happen is that I will have a pathology called as Pseudomembranous Colitis. Pseudomembranous Colitis B. So this is the pathology which I will be having in case in my body if there is toxin B. So how does this pseudomembranous colitis look? When you look at the colon, right? When you look at the colon, on the colon there are many different types of pseudomembranes, false membranes that are formed, like plagues, you know, like scales. They're formed like scales. Let me show you the picture of that. You see this picture over here? So you see all that white color fatty plaques which are deposited, this is called as pseudomembrane, right? So this picture right now which I am showing you, this is a picture of Pseudomembranous Colitis, Pseudomembranous Colitis B, right? Right. So finally, we have discussed enough now. Now what we are going to discuss is that what are the risk factors? What causes this Clostridium difficile to show its pathogenicity to us? What are the risk factors is that the first thing I have already told you that if the patient had recent antibiotic use. So a patient comes to me and he complains that, doctor, I have got watery diarrhea and I have severe abdominal pain, I have crampy abdominal pain, right? So crampy abdominal pain is seen only when, when there is severe inflammation of your colon, severe inflammation of your intestine. So a patient is coming to me, he is complaining that, doctor, I have severe crampy abdominal pain. And I ask him, how are your bowel movements, how are your stools? He is telling that my stools are completely out of control, right? So they are not solid, they are completely loose. I have watery diarrhea, literally water. So patient is having watery stools because of cytotoxin A, right? Toxin A, and patient is having what? Patient is also having severe abdominal cramps because of toxin B. So finally I diagnose the patient, right? I take a biopsy or I put a colonoscopy or whatever it is, I diagnose the patient as the patient is affected with Clostridioides difficile. Now, I'll ask the patient, did you had any hospitalization before? The patient will be telling, yes doctor, last week I have admitted in the hospital. I have admitted for a month, right? Last week itself I got discharged. Before that I was in the hospital for a month and they gave me aggressive antibiotics. So what is the concept, what is a clinch point which you have to think here? The important point which you have to think here is that patient was using antibiotics and that what caused the complete removal or the complete killing of all the microflora, leaving Clostridium difficile. So recent antibiotic use. So if you ask me, can you tell me what are the few antibiotics that the patient used? Yes, one is clindamycin. Most common cause of Clostridium difficile or Pseudomembranous Colitis is clindamycin. Okay. The second one is ampicillin. Second one is ampicillin. Third one is cephalosporins. Cephalosporins. And finally, you have got fluoroquinolones. Right? So I have also told you one more important thing, right? What was that? That was PPI. PPI stand for proton pump inhibitors. So these are the basic risk factors. Out of this, what you have to remember? This one. This is very, very important, right? And this one as well. Okay. So now let us switch on from risk factors to the symptoms of the patient. When you look at the symptoms of the patient, what are the basic symptoms which you are going to find in this patient? First symptom which I have already told you is that patient will have what type of abdominal pain? Patient will have crampy abdominal pain. Apart from crampy abdominal pain, what all the things patient will have? Patient will have watery diarrhea. Watery diarrhea. So when I tell watery diarrhea, one thing you need to keep in mind, that is this diarrhea with the blood or without blood? It is without blood. No blood in that. Okay? No blood in that. So crampy abdominal pain and watery diarrhea are the most two important symptoms. Third thing is that obviously when there is a loss of water loss from your body, when you are severely dehydrated, when electrolytes are lost, obviously you will feel malaise. You will feel weak also. You will feel fatigue, right? So when you do the physical examination of the patient, what do you find? In the physical examination part, what do I find in my patient? What do I find? You tell me, what will I find in physical examination? First thing, patient was having crampy abdominal pain. So when my patient is having crampy abdominal pain, so what type of symptom I will encounter in the patient? When I palpate his intestine, will it be soft or tender? obviously there will be tenderness of abdomen. Point number 2, patient is having watery diarrhea. So when patient is having watery diarrhea, so what is the physical symptom which I can see? Yes, that is dehydration. How I can see dehydration? Patient will have reduced turgor, patient will have less elasticity, patient will have sunken eyes. So all of these are the problems of dehydration. And obviously patient will have fever. Obviously it is a bacterial infection, so patient will have fever obviously. So after doing physical examination, right, let us make up a case, guys. Let us make up a case. Now in this case, what I do is that a patient is coming to me complaining that, doctor, I have watery diarrhea. Now I will ask him, do you have any abdominal pain? Yes, I have severe abdominal pain sometimes, and the abdominal pains are crampy, and can you have a check? Now I will tell the patient to sleep on the examination table, right? Now I check his abdomen. When I check the abdomen is tender on palpation. Not only that, by looking at the patient, another important thing I can find is patient is having sunken eyes, patient's lips are completely dry, patient looks dehydrated, right? Patient looks pale. So these are the signs which I find. Now after looking at this, then what I do is I have to do some investigations, I have to do some imaging, right? So what is the imaging which I do is, patient is complaining of abdominal pain. I am not sure what it is. So it is better if I take a CT scan of the abdomen and find what is going on in the intestines of the patient, right? So what I do is I take a CT abdomen. So when I take a CT abdomen, how am I going to see in the CT abdomen? Look here now. Let me show you the CT abdomen. How does it look? Right. So as you can see this picture over here. Now in this picture, what all things you can see? This is your vertebra over here, and look, this is your colon. This part is your colon like this. Right? The colon is fine now. Don't think the black spots here. The black spots is nothing but the air or the gas. So the colon is fine. But look at the colon above. Look at this colon. The colon is so inflamed that you see dark whitish thing here. This dark whitish thing is nothing but the wall of the colon has become thick. Let me draw it and explain to you. For example, this is the colon which you are seeing here. This is the colon which you are seeing here. Okay. Now look at the colon here now. This is the colon which you are looking here. You see the walls of the colon are how thick here? The walls of the colon are too thick. What happened? What caused the thickness of these? Because inside the colon what was happening? Inside the colon there is heavy infection that we called as Pseudomembranous Colitis. There is heavy amount of bacteria, right? Not only bacteria, there are plagues everywhere. There are different types of plagues everywhere within the intestine. And not only that, there is some type of reddishness. What does this reddishness mean? There is bleeding, right? So patient is having pseudomembranous colitis where the colon will be severely inflamed. So whenever you see inflammation, you will see swelling. So this is the thickness, this is the swelling in the form of thickness of the colon wall. As you can see in the CT scan here, see how thick the colon wall is. See, whatever I am highlighting here is the thick colon wall. How thick the colon wall is here, right? So overall, how does that look? The same picture, look at this same picture, right? So I'm rubbing it out. So look at the same picture and compare this with the picture below. It looks same. So this is called as accordion, right? So this instrument is called accordion. So and this sign is called as accordion sign. So if I ask you a question, if you get a question that where do you find accordion sign? Accordion sign is found in pseudomembranous colitis. Keep that thing in your mind. Okay, so let us go back to the topic now. So what I was telling, when you do a CT investigation, you see one finding that is called as thickened colon wall. So thickened colon wall, and not only that, you also see another important sign, that is accordance sign. Right, so you see this sign, particular sign, that is accordance sign. Clear? Right. So another important thing, that the patient will ask me, no, obviously I will do a CT abdomen. Patient was having crampy abdominal pain. I will do a CT abdomen and tell the patient, look, you have got a thick colonic wall, right? So I think it is an accordance sign. So I think you are suffering right now with pseudomembranous colitis. So when the patient asks what is pseudomembranous colitis, you have to explain that it is a very severe condition where your colon is inflamed, and this happens mainly because of antibiotic use like clindamycin. Now the patient will ask you that, doctor, even I had watery diarrhea previously in my life, right? So watery diarrhea is also seen in case of ulcerative colitis. It is also seen in case of Crohn's disease, right? So I see, because my friends had Crohn's disease and ulcerative colitis, and they had diarrheas. So how is it not me getting those problems? So you have to explain them that in case of ulcerative colitis, one thing you need to know, that the patient has diarrhea, I agree, but this diarrhea is bloody diarrhea. This diarrhea is bloody diarrhea, right? So not only that, in ulcerative colitis you also encounter another problem, and that problem is the skin rash, that is erythema nodosum. Erythema nodosum, right? So why not Crohn's disease? Because even in Crohn's disease I see diarrhea. Right. So why not Crohn's disease? Because even in Crohn's disease also there might be bloody or non-bloody diarrhea. Bloody or non-bloody diarrhea, right? But most commonly, what happens in Crohn's disease? What do you find? In Crohn's disease you find fistulas. Fistulas are common in Crohn's disease. Okay, fistulas are common in Crohn's disease. Fine. So doctor, please treat me. How are you going to treat me? So what is the treatment plan which you are going to give? The first thing which I encounter to the patient is that metronidazole. I give metronidazole to the patient, right? So I take metronidazole. I have pseudomembranous colitis and I am taking metronidazole. So even after taking metronidazole, the bacteria is not listening to metronidazole. The bacteria is not afraid of metronidazole. It means the bacteria is becoming resistant to metronidazole. So in that case, I use vancomycin, oral vancomycin, right? Third important thing. For example, I have used oral vancomycin in a patient, right? So a patient is coming to me, and all that case which I have explained to you. Now I started the patient on metronidazole. When I gave metronidazole, the patient became resistant to metronidazole. It means from next day onwards, when I started giving metronidazole, it did not work. Why? Because the bacteria got resistant to that. The bacteria is not afraid of metronidazole. So then I switched to vancomycin. When I switched to vancomycin, everything went well, right? Everything went well. The patient responded and pseudomembranous colitis is vanished. Now the patient is absolutely fine. But after 1 year, the patient again gets the same problem, but this time the patient is getting the problem again and again recurrently, right? So if you see any kind of recurrent cases, then please give a drug called as fidaxomicin. Fidaxomicin is used in case of recurrent cases. recurrent cases only. So oral metronidazole and fidaxomicin. So these are the two drugs which you have to give. Thank you so much guys.